Welcome to Consultation Blueprint. I'm really excited that we're going to go over what are the things that help trainees unlock their career. My name is Erwin Kwun. I'm a GP author and educator. Since 2021, I've helped GP trainees pass the SCA and SCA. I've seen people who've sat the exam multiple times and what were the things that hold them back. And going through this process, I acquired different insights from preparation of over 350 GP trainees. And I use that unique perspective to help other trainees because there's usually these common patterns that keep reoccurring. And today I'm going to show you how to do that. You know, in the last October sitting, the pass rate was barely 60%, which means that 4 out of 10 GP trainees are not passing the SCA. So this is a tough exam, but with the right preparation, you can pass this exam. Okay. So let me actually ask you, who has been following my content on YouTube? So going through this process of helping GP trainees, we have documented the journey of many of them, and some of them are here today, like Dr. Lawrence, and you're going to hear about his story later. And the reason I've been documenting this is to show you that what can be done to inspire some of you and show you that there is a way to pass this exam. So when I wrote Consultation Blueprint, I had two people in mind. The first one is an IMG who sacrificed everything, left their home country to come and build a better future in the UK. And some of these IMGs sometimes feel like they're misunderstood. They don't really know how to navigate a new system. And the second person I wrote this book for are the repeat sitters, those who've sat the exam multiple times, but still they can't see a way forward. And this book is dedicated to you, IMGs and reciters. Let me tell you a story. Dr. Donald Onoa is an IMG who actually worked really hard. His colleagues respected him, his patients loved him, and his trainer thought that he was going to pass. But every time he missed his exam by a few marks. And he was on his fourth attempt. That was the final attempt. And at 5 p.m. when the results were out, he looked at the results, it said fail. It was devastating. After so much work, sacrifice, he still fell short by 1.5 marks. And Donald felt this was a torturous journey. This is what he said. I shed tears. It was grueling, torturous. Imagine having to pick yourself up after 3 different attempts and then failing a 4th attempt. He felt the burden of the SCA on his shoulders. And one day his young child said to him, "Dad, when are we going to stop talking about this thing?" The SCA strained him, drained him, and took time away from his family. It was really difficult period of his time. Imagine being stuck in training for 2 years just because of an exam. Now, let me ask you a question. What do you think is a pass rate among IMGs? So some of you are a bit pessimistic here. It's actually 51%, but still it's low, okay? So you can see the odd was not in the favor of Dr. Donald. So his actual pass rate as a reciter who's sat it 4 times is even lower than 51%. If you know the stat, it's quite low if you've sat the exam 4 times. And there is a big contrast between UK graduate and IMGs. And the thing is, what some trainees don't realize is that it's not a level playing field. You know, if you're an IMG, you're coming at a very different starting point. Whereas the UK graduates, they have got training in their med school days on communication and consultation. Whereas some of you may not have benefited from that training. So you have to catch up. So Donald realized that there was a big gap between where he was and where he needed to get to. And the only way for him to sit the exam and pass it next time was to bridge that gap. So he asked himself, if I keep doing the same thing, I'm probably going to get the same results. So he decided that he needed to take a different approach. And luckily, his deanery gave him one last attempt. It was an exceptional fifth attempt. And this was going to make or break his career. If he passes the exam, he would become a GP. If he failed the exam, then he could say goodbye to his GP career and had to find some other jobs. And that was really difficult when his colleagues was passing his exam without doing much effort while he was stuck in training. So we actually met and we bridged this gap by using the principles of Consultation Blueprint. And you're going to learn exactly what he did. So 3 weeks before exam, he reached out to me and said to me, I don't know what I'm doing wrong. And this is my last attempt. So we started working together. We looked at what was holding Donald back. And there were quite a lot of things. So we unpick these old habits. You know, when you keep practicing, reinforce these bad habits, it can be difficult then to unlearn them. So there were examples such as over-explaining, missing cues, interpersonal skill. And Donald did not refuse, did not actually was a person who did not like feedback. He actually embraced feedback and he refused to give up. He showed up every day, even when there was difficulties going on. He had his family commitment and he eventually passed his exam and he bridged that gap. So this is what he said. I'm happy I can look back and smile. And the reason I'm sharing this story with you is simple. No matter which attempt you're doing, whether it's your first attempt or your final attempt, if Donald can do it after all these setbacks, you can pass his exam. And today I'm going to show you the blueprint that Donald has used. And this is a video that he sent me. Now he's able to play the flute after having this SCA burden lifted off his shoulders. And he's enjoying his life. So today you're going to learn how to build confidence. Confidence is a big part of this exam because if you're not confident, then everything can go pear-shaped on the day where you have to perform. The second principle is revise smarter, not harder. Some of you here are really hardworking, but you're not seeing results working hard. You know, working hard can only take you so far. And the last one is the art of consulting. So who's excited for today? Let me know in the chat if you're excited and we'll get started. Great. Thank you, Tanya. Thank you, Shoma. So let's get started. So stay until the end because I've got an offer for you. This is a launch offer that we're doing for celebrating our community where we have lifted the success rate of IMGs. So you're going to get a chance to get a copy of your book, Consultation Blueprint, and I'm also going to give you a free bonus. So most GP trainees assume that they need more knowledge and they think that if they read nice guidelines, if they know so much, they're going to do well for the SCA. And this is very common among those who lack confidence. The truth is, you do need knowledge, but knowledge is one of the elements. It's necessary, but it's not sufficient to pass your exam. Because the SCA is not just a knowledge test. It is testing how do you manage risk when you don't know the answer? How do you navigate uncertainty when there are things that you're not aware of? When you don't know the diagnosis and when the patient is asking you questions that you did not expect? How do you care for your patients when they are actually very anxious, when they're asking questions or when they don't really tell you what's going on in their mind? And it's really hard to do it because if you just have knowledge, it doesn't mean that you have competence. So Very important for you to distinguish between competence and knowledge. And it's not a good idea just to get knowledge, but not able to show it on the day. Those who do well, they have developed that competence early before the exam. And it's difficult to actually consult well when you know the pressure is on, when the clock is ticking, and you feel like this exam is going to be quite challenging because you're going to be assessed. So let me tell you about Dr. Lawrence Harpington. He's a GP trainee who sailed through training. He's a kind of GP trainee who you could bet money on. But then he got his first SCA results, 69. Not enough to pass, not enough to move forward. It was a big blow for him. And he lost his confidence, his training got extended, and self doubt creeping. And at one point, he even asked himself, am I going to pass this exam? And it felt like he was on a trajectory to finish his training, but then the SCA came and crushed this. So we changed two things in Dr. Lawrence's preparation. The first one being the language. You know, what comes out from your mouth is really powerful. If you keep actually doubting yourself and the language that you use or words that creep these doubts, actually expand this doubt, then you're not going to do well. So instead of thinking, what if I fail? We focus on how can I pass? So it was shifting from fear to actually looking at what are the solutions? How can I pass? And the second thing we changed with Lawrence was a lens through which he see things. And it's about perspective. So he started seeing himself able to actually do well, and he started to believe that he could pass this exam. This is so important. If you approach an exam already self-defeated, not thinking that you can pass it, then you're going in half-heartedly, and it's not a good mindset. Those who do well, especially after a failed attempt, they rebuild their confidence and they believe in the preparation and they trust that they can pass this exam. So believe in yourself. And in 4 weeks, Dr. Lawrence's score went from 69 to 87 by applying the principles of Consultation Blueprint. And this is what he said: I passed, it's been a difficult journey, but I thank God for the end result. And here are the lessons. You know, this exam is not something that you actually wing it. If you don't want to fail this exam and you want to pass it first time, you need to prepare well. So most trainees are actually worried about things they can't control. And I have to say, I used to worry a lot about things I can't control. And you don't realize how much energy and time you waste by worrying things that you can't change. So for example, you can't change what are the examiners going to actually mark you as. That's the outcome that you can't really make any difference. You can't really do much about IT glitches. It can happen. You can't really do much about what cases you get. You don't know what cases you're going to get. But what is in your control is your mindset, how you approach the exam, your state of mind. You are in power of that. And that's really important because if you lose control of your state of mind, that's where you get anxious and you lose control of yourself. You can control your behavior. You can control how you prepare. And if you work on the things that you can control, then you can start influencing other things that's outside of your control and show the examiner, no matter who the examiner is, that you deserve to pass the exam. Does that make sense so far? Yeah? So control the controllable and don't worry about things you can't control because it's a waste of time because by definition, you can't control them. So another really common phrase I've heard is practice makes perfect. Who here have been told, just see more patients, just keep practicing and you'll be fine. Who heard that from the trainer or from somebody else? It's really common. But is it really the truth? Because let me share with you the story of Dr. Chisholm. She failed her exam 3 times, the RCA. And then she sat the SCA and failed it again. So imagine she's already gone through 4 sittings and she had extension after extension. And it came to a point where she lost her placement. Dr. Chisholm was thinking, I was in training, I was getting feedback from my trainer, still I fail. I was seeing patients. She was doing everything she could, practicing, role playing, everything, but still she couldn't pass this exam. If practice made perfect, then by the amount of practice she actually put in, she should have passed by now. But the thing is, if you keep practicing your mistake, you don't get better. You actually get better at making mistakes, and it reinforces that bad habits. And actually, this is counterproductive because then you're drilling these bad habits, and it's going to take longer and more effort for you to unpick these bad behaviors and change it. And this is why so many GP trainees plateau. They've reached a point where they're working hard, they're doing what they've been told, seeing patients, role playing, but they're not seeing any progress. And this is where they start doubting themselves. And Dr. Chisholm, when she reached out to me, she said to me, I've lost all hope, all confidence. I don't know what I'm doing wrong. And I was thinking when I spoke with her, how is it that somebody spent so many actual attempts going round in circle and not seeing any progress? And I thought, she doesn't need more practice. What she needed was a different approach. And I'm going to show you what approach we actually took with her. But let me ask you, what do you think is the cost of being stuck in training for another year? Just think about it. And the cost of failing her exam time and time over was 6 grand in exam fees. You know, she sat her exam 5 times. The emotional toll, the loss of confidence, the loss of earning, and her career was on the line. She was not seeing any patient at all by the time she was sitting her 5th attempt. And she was doubting whether she could make it. So there's also the opportunity cost. She could have been earning more than what she was earning, but because of being stuck due to the SC exam, she was actually capped at the earning of a GP trainee. But because she was out of placement, she was not earning anything at the time. So it was really desperate for her. And it was not easy because she also had some neurodivergent challenges. And the SCA exam board did not give her time in her consultation. Yes, she had a bit more reading time, but she didn't have more time in her consultation. So it was really challenging for her. And sometimes you might think, I can figure it out on my own. And this is a common trait among trainees who go through this exam multiple times, especially those who miss it by a few marks and they think, I just need to work harder, next time I'll do it. But because it's happened 4 times already, Dr. Chisholm realized if she kept doing the same thing, she'll get the same results. And she didn't want to risk her last attempt. So she joined Consultation Blueprint one-to-one coaching. And actually, we analyzed what was the problem in her previous preparation. What was the reason she kept failing despite working hard? And the truth is, she had this blind spot, this unknown. And the cruel thing is, nobody spotted this blind spot. That's why she kept failing over and over again. So I introduced her to the graph loop, which is in Consultation Blueprint. And this approach actually helped her to break that vicious cycle. And we look at 4 steps process here. Practice, self-assess, getting feedback, and this was a missing piece in her preparation, and then adjust. Every time she went through this loop, she identified a blind spot and fixed it. And one of the main blind spots I've seen among IMGs is to do with ideas, concern, expectation. Yes, most trainees have heard about ideas, concern, expectation. They think they're doing it well, but actually, that was not the case for Dr. Chisholm. And this is what she said. Knowing ICE early was a game changer for me. Once I began to ask ideas, concern, expectation early, my whole consultation made sense. So in the past, she used to ask ICE just at the end of her data gathering. And then she had to actually spend more time to ask more targeted questions. But when she asked ICE earlier, she knew what this case was about and she knew what was the worries of the patient, so she could ask more relevant questions. And more importantly, she learned the importance of readdressing ICE. So many trainees, they learn how to elicit ICE, but they don't do anything with it. And then the patient leave the consultation still worried about what they came with. And that's why the interpersonal skills score is not really high, because you have not readdressed the patient's agenda. So we fixed this problem, and she actually had to work quite a bit, to be honest, because there was a lot of gaps in her preparation. But she was up for it because she was up training, and actually not seeing patient gave her more space to prepare for the SCA. And in the consultation blueprint, this is one of the philosophies. We don't rise to the level of our expectations, we fall to the level of our training. So this time round, she was not winging it. She was not thinking on the day of the exam, I'm just going to rise to that goal. She prepared every week. And she prepared with her husband as well, who was role playing with her. And she was trained to such a high level that on the day of the exam, this time around, she walked in calm. She was not worried about anything. And she scored 81 on her fifth attempt. And the reason I'm sharing this with you is because some of you right now might feel, I'm never going to pass an exam. But if Dr. Chisholm has done it, despite being out of training, despite being defeated, despite being somebody who's got neurodivergent issues, then you can do it. With the right system, you can also pass this exam. She went from 72.5 to 81. So who here feels like the SCA exam is not fair? I know some IMGs and researchers sometimes feel like there's subconscious bias, there's a subjective exam, and this is a message a GB trainee actually shared with me. He sat his exam multiple times, um, and all the time his interpersonal skills score was stuck at 18. And he was a GB trainee that was really hardworking. And he could understand why he was failing. And he thought maybe this exam is not fair, there's subconscious bias. And he even appealed because he was feeling a bit fed up. And it's true, this exam is subjective because even examiners, they don't agree among themselves. But if you go into an exam with that mindset, thinking it's not fair exam and it's subjective, then you're already going in with the wrong mindset. Okay. So this doctor actually, he could not change what the exam was, but he learned that the only way for him to actually pass his exam was to change himself. And when he changed himself, he was able to pass his exam and his score in interpersonal skill went up. But that change has started with his mindset. So the mindset is no matter who the examiner is, despite the subconscious bias and everything, I will show the examiner the evidence that I can communicate with the patient and I deserve to pass. And that way, even if it's a strict examiner, they have to pass you. And that's more powerful than playing the victim and complaining and appealing. Because in my experience, appeal doesn't work. Nobody has been able to pass exam after an appeal just by appealing. You have to resit your exam. And it's a waste of your time, resources. It's much better to change yourself and agree. Maybe it's because I wasn't ready. So now let me share with you the third principle. This is the art of consulting. And I'm going to share the story of Dr. Irbaz, who is a top scorer. He scored 100.5 in his sitting. Now you might think this person must be a natural. How is this person getting over 100? But what you might not know is that Dr. Irbaz failed his first attempt with a score of 70.5. And it was devastating. He then shared with me that he was not connecting with the patient. He said, I was missing cues. I wasn't really present. And the truth is, many trainees are shocked when they find out that they don't pass exam because they thought they were doing well, they received good feedback. But sometimes some of the feedback can mislead trainees and build this sense of overconfidence. And what was really devastating for Dr. Irbaz was that interpersonal skill was one among the lower score that he got. So what happened with him was that he had to pick himself up, he had to prepare, and it was really difficult. In his own words, he said that it was shattering. The essay was shattering. And if I share with you that he was not an IMGs, he was a UK graduate and still failed his exam. So you see, it's about how you prepare. And the problem with Irbaz was that in his first sitting, the timing was not right as well. He was not sleeping well, and he even had nightmares the night before sitting the SCA. So, do you want to know how Dr. Irbaz went from a score of 21 in relating to others to 34? He actually had to change a few things. So, he joined the Consultation Blueprint, and we look at his preparation. And what I've noticed when I actually look at his consultation was that he's a really smart doctor. He knew his medicine, the knowledge base was top notch. But the problem was he was so focused on the medical that the interpersonal skill in terms of the psychosocial and the eyes was not done to a very high level. So he had to change his approach. So sometimes you might think the SE exam is a checklist exam. I just need to checklist, go through this, and I'm going to get there. But the truth is, the exam is not a checklist. And if you're approaching it with that mindset, chances are you're just doing one part of it. So getting the medicine right is not enough to pass the exam. You have to get the human right. And when Dr. Irbaz consulted with his mind and his heart, we started to see the human side of the consultation. He learned to marry the science and compassion. And he was present this time. Instead of worrying what question I should ask next and thinking, where am I right now? He was present, giving his full attention to the patient. And this time around, he actually improved his score and went to 100.5. So I hope you found this story so far inspiring. Now I'd like to share with you one of my favorite frameworks in Consultation Blueprint. So who would like to learn about this framework that will help you to boost your score in interpersonal skill and management? Give me a one in the chat, please. Yeah, great. Thank you, Tanya. Thank you, Prashant. Great. So Christmas is coming. Something you might be thinking of getting a gift for somebody. Imagine you've been thinking about a gift and you put a lot of thought in that gift, knowing what the person's preference is, what would be the best gift for them. But then you give that gift in the cardboard box that you receive it. How do you think that person would feel Even though the gift is wonderful and it's incredible, the experience, the person when they receive it in this cardboard box is flat. No wrapping, no note, nothing, no packaging. I've seen this so many times in consultation. GP trainees giving sound clinical advice, good medicine, but then the delivery falls short. You see, in the SCA exam, you're being assessed not only on your medicine, but how do you deliver it? And this is where gift wrapping is vital. When you gift wrap your plan, it feels like the plan fits the patient like a glove in the hand. And I'm going to show you the steps involved in gift wrapping. So G is to gather insight. And this part of the history is really important because so many times I've seen GP trainees, when they're gathering insight, they are taking a history like a hospital doctor, just going through their medical history, family history, drug history. But in a 12 minutes consultation, that's not the right approach. And let me share with you a quote from Sir William Osler. He said, "The good physician treats the disease. The great physician treats the patient who has a disease." So when you're gathering insight, don't just think about what symptoms, what's the diagnosis, but be curious. Learn about your patient, about the person behind the problem, the symptoms they're having is important, but you need to know a little bit more about the person. And when you ask your question, ask open question to find out more about the patient. Don't ask questions that sound formulaic. Sometimes I've heard people say, "Who lives at home with you? Do you smoke?" These questions, they are asked out of context. And it's much better when you ask questions that are in context. For example, how's this headache affecting you? Do you get any help at home when you're not well? So that way you're gathering insight. You're not just checklist questions that you're going through. So once you understand the patient, then what happens is that you would realize, okay, this person is from the travelers community. So you're already thinking there might be some issues with continuity of care here. So that insight is really useful when it comes to making your plan. So then when it comes to the next step, it's to individualize. So you don't want to give a generic plan to everybody who comes in with diabetes, because then the plan does not fit to that person. So for example, you got somebody who's from travelers community, newly diagnosed of diabetes, and you're telling them that they have to actually come for a blood test in 3 months time. If they don't know where they're going to be, then it's going to be challenging. But if you understand the patient, they feel like you understood them and you care for them by individualizing your plan, then they're more likely to accept your plan than resist it. Okay. Similarly, if you've got a patient who's got conjunctivitis, you might prescribe that patient chloramphenicol eye drop. That's great. But what if the patient has severe arthritis and they can't really squeeze that drop in the eye? Then the chloramphenicol eye drop is useless to them. But if you knew their comorbidity, you understood the problems in their life, then you might be thinking, I need to adapt my plan here. So maybe suggest an Opticare Ortho dispenser, or check whether there could be somebody else who could administer this eye drop. And that makes a big difference between an unrealistic plan to one that works. Does it make sense so far? Yeah, great. So the next step is framing. Framing is all about how do you deliver the message. You know, giving advice is easy, but receiving advice is hard. Most people don't like it when you tell them what to do. And so often, when the pressure is on, when you're rushing, you just tell the patient, you should stop smoking. And the patient feels like you're telling them what to do, and chances are they're not going to agree to accept it. Whereas if you take a different approach, you tell the patient, I know you're planning to start a family, and that's exciting. However, I'd like to talk about smoking with you because that might affect your plan. Is it okay if we have a chat about this? So you see, the first one is like a lecture, and the second one is a partnership because you frame it based on the patient's interests. And that makes a whole difference in how the consultation actually is received by the patient. And T is to tie everything together. So you could make the perfect plan for your patient, but if the patient is not invested in that plan, they don't have that ownership, then they are not going to follow through. It's much better to make um, a plan that works for your patient than making a perfect plan that the patient is not going to follow through. So tying it all together is to give the patient ownership of the plan. And how do you do that? You involve the patient in the plan. So when you make a recommendation, ask the patient, how do you feel about starting this treatment? Or if you're asking a patient about stopping smoking, then you ask the patient, do you think that's doable for you to cut down? And it means that you care for your patient. And that way, you're not just giving them medical advice, but you're walking the patient along that journey and they feel like you're actually giving them the care they need, the words, the meaning that you actually convey in your message. Does this make sense so far? Yeah. So next time you're role playing, please use this gift framework and see how your consultation goes. And you will see that it elevates your management and your interpersonal skill. So please share with me, what was the most helpful idea you learned so far? Write down in the chat what was the most helpful idea you learned so far. In the meantime, um, I've got two guests today who are going to join me, and I wanted to share the story with you just briefly. So let's first welcome Dr. Lawrence Appentang, who you've heard his story. Hi, Lawrence. How are you doing? I think you're on mute.
Hi, Dr. Kwun. I'm okay. Yourself?
Yeah, I'm doing very well. Thank you very much for taking the time to attend this book launch today. And for somebody who actually is struggling with the SCA preparation right now, um, and maybe they failed the exam, what one thing would you like to say to that person?
Right. I think you perfectly summed it up. Winning mindsets, changing, having a positive mindset. Um, because I remember when I came to you, I was quite, devastated after I had failed my exam. Um, I think around that time, what happened was usually, so basically, what happened was I was in my third year. I was transitioning to be a full-time GP. I'd already prepared for that. And then unfortunately, I failed my exams, which was not something I'd expected. And imagine as an IMG having to deal with visa issues around that time. We did not have the 4-month post visa now. That is a thing. It wasn't really something that was there then. So it was something that was being deliberated. So I had already made plans. I had sat MSRA, had a psychiatry slot. The plan was just to transition so that I didn't have to worry about visa issues and all that. And then unfortunately, I had received the bad news. So I was quite devastated, quite heartbroken. And for me, I remember before sitting the exams and all that, I had come across your platform on my Facebook and I'd already reached out to you. But for some funny reason, I had decided to go to other courses, which unfortunately did not help me at the end of the day. So I I reached out to you. I remember because I kept seeing your message on my timeline, your messages on my timeline, and it spoke much. It spoke to me in terms of how IMGs, what we go through, and the kind of approach that is needed. So when I reached out to you, in fact, I would say it helped me a lot because I realized that I had a lot of self doubt. I had lost a lot of confidence. And I remember that during our one on one consultations, you spent dedicated time in terms of changing that mindset. And then from what if I fail, what if I fail to how can I pass? What is needed to pass? Um, this is besides the approaches and then having one-on-one time to go through the cases, practice and all that. So it was quite, I'll be honest, it really did boost my confidence. So on the day of the exam, funny enough, I should have been panicking and all that, but I was very, confident on the day of the exam. It was more about how best I can, listen to the patient, solve their issues, and not thinking about, oh, I have to ask these questions, ask this next question, and all that. So that approach was actually good. And for me, it was that winning mindset that helped me a lot, which helped me to finally pass the exam. So I cannot recommend it enough. If I don't know how many people are resitting, I don't know who has failed and who has joined us now, but then this book would give you whatever you need to pass it. If I could do it, anyone else can do it. So I cannot recommend it enough.
Thank you so much, Lawrence. It means a lot because you have also helped me while writing this book and given feedback, and that was really helpful. And in a moment, we're going to actually hear Dr. Irbaz's story as well. Let's continue the presentation, and in a moment, we're going to hear his story as well. Thank you so much, Lawrence. It means a lot. And
Thank
you're going
you.
to learn about Lawrence's case study in the book. It's also in the book, and you'll see what principles that's helped him. So, thank you for sharing what's been useful to you so far. Now, some of you are thinking, right, so this consultation blueprint is a new way of doing it, and I want to know more. So, let me share with you a little bit more if I have your permission. So, it is designed based on my experience having helped over 350 GP trainees, and you've heard Dr. Lawrence, one of them today, and it's designed to help you pass your SCA with confidence. And why confidence is one of the emphasis in this program is because I've seen many times how confidence plays a big part in this program, in this exam. Whereas some trainees go in overconfident and then they get shocked when they see the results, and then afterwards they are underconfident. So you don't want to have this sense of overconfidence. Neither do you want to go in underconfident. You want to go in with the right level of confidence. And growing up myself, I used to be really shy. I didn't have much confidence. Just the idea of speaking with somebody made my heart race. And I had to put in so much work and get outside of my comfort zone to actually break through that mold of being a shy person. In sixth form, I was voted the shyest kid of the year. So it took me a lot of hard work and had to do things that I didn't want to get outside of that comfort zone. And now I'm able to help others to rebuild their confidence. And it's really rewarding. And I want the same thing for you to help you break that mold. So just to give you some context, 1 in 2 IMGs are failing the SC exam. And by applying Consultation Blueprint, we've achieved a pass rate of 80% consistently. So the trainees who are going through this program, many of them have failed the exam before and are struggling. And by applying this, they've managed to get the results they want. So it is based on different phases. So the first one in the book you will see is a foundation, how to lay the foundation and mindset being a big part of that. Then you learn how to revise smarter. I've given you some principle that Dr. Chisholm used. Instead of just working harder, she works smarter. Then there's other principle in the book where in the last chapter is a consultation mastery. So this is where you learn how to consult with the art of consulting. And the gift wrapping is just one of the framework in the book. So we get you exam ready such that by the time you sit your exam, you feel you've done the best preparation. And no matter what happened on the day, you can still shine. So it's based on people who've done the exam first time as well. So this is Dr. Randika, and he passed his exam with a score of 99 on his first attempt. And he says everyone has potential to pass this exam. And he came in as an IMG and just started GP training. So you can imagine the NHS system was new to him and the British culture as well. So he broke through this language barrier, the different challenges that IMGs face, and scored well. So today you are getting that launch offer. If you would like to get your copy of Consultation Blueprint, I'm going to give you a bonus, a free bonus. You're going to get an invite to our upcoming SCA masterclass. Time management, interpersonal skill, and clinical management are the common challenges that trainees face. And we're going to get in more actual teaching so that you can apply this. So if you'd like to get your copy, go to drerwinkwun.com and you can get yourself a copy. There's a lot of things in this blueprint. So you're going to learn about the strategies, how to maximize your score, and proven methods to manage your time, how to refine your consultation. More importantly, how to manage complexity, risk, and uncertainty under pressure. And I go in details about what are the causes of failure, and I show you scripts and proven example how to boost your interpersonal skills. So if you're thinking about sitting your exam and you want to get the guide that will help you get there and close that gap, so you can go to drerwinkwun.com. So some of you might have watched my free content on YouTube and have benefited a lot. If I've helped you, if by watching one of the case studies or even one of the podcasts, you've benefited from that, then help me on my mission to help more doctors. If you know somebody who might be needing this book, please feel free to give it to them. Buy yourself a copy and buy a copy for your friend or your colleague and give it to that person. And by doing that, you might also be helping another colleague who is struggling right now. And if you're preparing in your study group, if you help others in your study group, you're going to elevate your study group as well, and that can help you. So go to drerwinkwun.com and you can get yourself a copy. And once you've got yourself a copy, please send me an email with your receipt and I'll give you access to the SCA Masterclass coming up. Now, some of you here might want more than a book. Maybe you've tried this exam multiple times and still you have not succeeded. Maybe you've got support from your deanery, from examiners, but still you're feeling like, I don't know what I'm doing. And for those people, I've got something more special for you. If you want to work with me and get the same experience that Dr. Lawrence, Dr. Irbaz, Dr. Donald got, where you're not just going and walking this path alone, but I'm going to take you from the start to finish. And you're going to follow a proven path so that you're not wasting more time and energy. Then you might want to join Consultation Blueprint program. This is a program that will help you bridge that gap between where you are right now and where you need to get to. And this is where you will actually learn how to rebuild your confidence so you can perform under pressure. And we fast track that journey for you, give you the targeted approach and fix your blind spot. Fix your consultation flow so it feels natural, not rehearsed. Now, it's not for everybody. It's only for those who are serious. And I'm going to give you a bonus gift, actually free bonus gift I'm going to give you. The first one is SCA Immersive Workshop. So you're going to come on one of our workshop where we're going to do 12 live role plays of high yield scenarios. You're going to learn advanced communication skills and get feedback from myself and our role players as well. And this will help you to navigate uncertainty and navigate these complexities of the exam and the exam condition. And you're also going to be invited to our monthly masterclass. So every month I run a teaching for members of our program, and you will get an invite and you can attend it. You'll also get access to the online program, the course, where you'll be able to learn at your own pace. And there's case demonstration of high-use scenarios so you can learn from them. In our program, we don't just do cases over and over. Sometimes people feel overwhelmed by doing hundreds of cases but not seeing any progress. We focus on the quality, how to do a case well. And that is what you do when you work smarter, not harder. So, will you be part of a community? How would it feel to you if you join a community of other trainees who are also aligned, committed, and you're not having to struggle to find a study partner? Then you will get a chance to join our thriving community. Okay, so this is an offer that Dr. Asim Bilal actually joined. He failed his exam 3 times, worked a lot on eyes, especially in his third attempt, but could not pass his exam. And he didn't know what else to do. Imagine failing your exam 3 times, and every time you're missing it by a few marks, and you're up to your fourth sitting. And that was really difficult for him because he's been working so hard, he's tried his best, still he was not making any progress, and he was stuck in training. And the cost of resitting your exam, if you're actually sitting your exam for the fourth attempt, then it's around 5 grand. Okay. And if he failed that exam, he would have to spend another 1,200 grand, 1,200 pound. So the cost of resitting an exam is very expensive, and you don't want to have to keep paying the RCGP exam fees and not getting anything in return. So Asim realized that every time he was doing this, he was not getting closer to his goal. It was actually getting further because in his mind, he was thinking he won't be able to finish his training. And after sacrificing so much, changing his career from ED department to actually come to GP training and not qualifying, not getting that CCT, felt like that's something would be really a regret for him. So he went all in. He joined the VIP package and we worked together. He went from 73 to 86. And this is us celebrating his actual achievement in Cardiff. And he's still in touch with me today, and he's now able to work. So the cost of sitting the exam is actually quite high. I've seen trainees going through this process, and it's not just the money, but also the time, energy, and the stress. And if all this does is help you finally pass your SCA and unlock your career, given we know that there are trainees, especially recent candidates who are spending 6 grand in exam fees, do you think that getting that burden lifted off your shoulder and finally get back your life would be worth £6,000? I think it would be worth more than £6,000. Because once you qualify, you're opening up opportunities. You can double or triple your earning potential. So we've had trainees who've joined this program and now are working in Canada. They're earning around 200 grand a year. Whereas right now, you could be doing that, but the reason you're not able to earn that much is because you're stuck in training. So we've said that it would be worth £6,000, okay, to get a program that will help you unlock your career. In this VIP program, you will get everything we discuss, plus you're going to get me to mentor you. But you won't have to pay £6,000 for this today, okay? What if it was £3,000? Would it be worth it to unlock your career and finish your training? Maybe some of you think it's really expensive. You won't have to pay £3,000 to get that support today. What if it was 2,000? Would that be worth it? 2,000, you won't have to pay that neither. So I'm opening 3 spots to 3 GP trainees who are committed, and for only £600 today and 2 additional monthly payment, you can get the same level of support, guidance that the GP trainees you've heard today have. And We'll have a chat, see whether you qualify, because I only take people I know I can help. If I don't think you'll be a good fit, then you won't have to join this program. There's no obligation. So if you're interested, then there are free spots available because I only can coach a select number of trainees every month. And once these spots are taken, then you'll have to wait next month for more spots to open. So go to calendly.com/erwinkwun/15 minutes or just scan the QR code. If you're ready for your breakthrough, you're tired of doing what you're doing and not getting the results, then please have a chat with me, book a call and see whether I can help you. And now some of you might be thinking, wow, this is a significant commitment. Yes, it is. It's not a small commitment. And my question to you is, how committed are you to pass your exam, finish training, start earning more? Because if you're not committed, this program doesn't work for you. And imagine you could get your freedom back and your life. Does that have a price? If you feel you've tried all the other program and it's not getting you the results you do, maybe you need something new, something different. And this is what Dr. Asim said. I wish I had known about Erwin Kwun earlier in my training career. I could pass my SCA exam sooner by enrolling into his coaching sessions. See, he could have saved himself exam fees if he knew about it, but he didn't know. And you know this program, and if you want my help, then feel free to get in touch. So, what is the cost of doing the same thing again and again? Can you afford another failure? Not just the time, but also feeling like you've done it, but you still miss that one last piece of the puzzle. And that will cost you another exam resit and also delaying your career progression, especially if you're planning to go abroad or become a partner. You're just in limbo. So we've talked about the cost of resitting the exam. Failing the exam is really expensive, but passing it is priceless. So how committed are you? If you're really committed, you want to do it, then book a call and we'll see whether I can help you. And I don't make any promises. I'll have a chat with you first, see whether you're coachable. So for those who are sitting your exam first time and you're looking for support, I've opened up 2 spots for the premium package, and it's only £400 today and 2 additional monthly payment. So if you're ready to unlock your career, then please feel free to book a call. Now I'd like to invite Dr. Irbaz Khan, who actually joined our program after failing his exam. So you might heard about his story, and let's see whether Dr. Irbaz is here.
Hi, Erwin. I'm here.
Hi, how are you
Hi.
doing, Irbaz?
I'm fine. Good morning. Really good to see you again.
Great.
Really inspiring story from Lawrence, which was good to hear.
Yes. So thank you so much for joining us today, Irbaz. Tell us about what's the reason you joined the program? Because you're somebody who actually analyze a lot and are quite logical. So what was the reason?
Yeah, I heard obviously you mentioned about kind of my story, what happened back then. And for me, I think when I failed, obviously it was a shock. But in the background, I think mentally before I sat the exam, I wasn't really there. I was sort of not very confident, and I guess it was a self-fulfilling prophecy, if you know what I mean. I mean, I kind of went in thinking I will fail. And even though I thought I did well on the day, I failed. So I think what I realized was that something is wrong in my kind of overall consult. And I think what I wanted to do was think beyond the SCA, to be honest. Because it's not just about passing the exam. I felt going into the clinics every day. I didn't feel confident, and I felt that's not right. Something needs to change. So my entire purpose was really to think beyond the exam itself, and actually I wanted to see day-to-day practical changes in my consults on a daily basis rather than, just do a course and sit an exam and pass, because that wouldn't really help me beyond that. And I think the potential, people need to be thinking about the potential beyond the exam. Um, so that my kind of motivation was really that I think I didn't leave any stone unturned in that sense. I chose the program, um, and I think it helped me because it provided me with a lot of structure, and it also provided me with the mentorship that I was looking for. Those were one of the few reasons, really, I think, I thought I should do this.
Yeah. So you thought that you needed that mentorship, that help. But then when it came to actually making a decision to invest in yourself, like, did you have any hesitation? Because sometimes you may think that's quite a significant commitment.
Of course it is. Yes. No, no, certainly did. I mean, I had hesitations, and that's partly because I was doing a lot of other bits and things, I wasn't sure if I could um, give the right amount of time, given I was doing a few other things. I was also thinking of doing a diploma at the time, which I dropped at the end because I thought, it's not the right time to conflate things. Um, so I thought. Personally, I thought I needed to give it my full attention and give myself the best chance to learn from it. So that was the kind of hesitation I had. But I think in hindsight, I'm quite glad that I did it, obviously. And I think the reason is because it's, I don't know, I feel like you're not, and nobody's going to be a consultant like me or you or other people out there. Everybody's just got to be the best consultant that they are themselves. And I think what happens is when you are mentored, you get that. You don't kind of become the person you're being mentored by. Or you might, I don't know, depending on who you are, I guess. But I think it's sort of it's about unlocking the best potential you have. And I think having said that, if you're doing other things, it's actually really good to get different perspective because, you know, you learn things that you like and then you learn things that you don't like. And I think what you can do actually is say, well, okay, well, I actually really like that. Like, I want to carry that forward, as much as I can. And then there might be things like, okay, well, I don't quite like that. And then you get another perspective. You're like, okay, well, this is another way to think about it. And I think realistically, what happens is then you form a really good consultant that you can be. It's not about being Roger Neighbors. It's about being the best version of yourself. And as you can see, it works well for you. And to be honest, the examiners, what I think is the examiners really pick on that. When you're sitting the exam and you be yourself and you're natural, you're in the moment, you're reflective, they pick it up, and that's all they need to see. They need to know that you can be a person-centered consultant and you have some knowledge.
Absolutely. I think you've hit it on the head. The thing is, there are many people trying to copy somebody else, and the problem is it doesn't feel natural. And then
Mm.
under pressure, everything goes out of the window, and then people revert to their old behavior.
Yeah,
Whereas
that's right. Yeah.
what you've actually shown is that you develop your own style and you borrowed things from different people, and you got that support to actually develop your own consultation that works for you, and that's
Yeah.
really the signature of it.
Yeah, and honestly speaking, I think a lot of it is about confidence. And I was there. I had, I've got your book, and I've been looking through it time to time, and it's a lot of stuff on there is really quite helpful. And obviously there's information on there, or stuff on there about confidence and actually having self-belief. And I think I was lacking that tremendously. And that was showing in my consults. I didn't feel I had the ability to do anything. And I, and I went into the consults. I was like, well, what can I do? I don't know if I can help you. Literally, I was in that phase where I was like, I never felt I was good enough. And I think sometimes what it was about regaining that confidence. I even did a bit of surfing at the end of July, a month and a bit before my exam, because I'm like, you know what, I need to do something that I'm afraid of doing, and prove to myself that I can do it. Because actually, that can-do attitude is it again. It shows on the day, and I know when I failed back in March 2024, was it? I think that I didn't have that can-do attitude, and it must have shown because it shows in the micro scales. It shows in the kind of the expressions you make on your face. If you appear a bit flat, you know, it just shows there's no energy to the consult. So I think having that confidence and doing something that, if you find that you're mentoring and you need that kind of build back in confidence, it will help you. If you find that actually going to do, something that you've never done before or you're afraid of, and actually overcoming that fear, that might be enough for you to kind of get your confidence back and get back on track. Everybody's different, but for me, absolutely, Irvin, it's you got to be the best version of yourself. That there's no question about that.
Absolutely. Thank you very much for sharing your experience today. And also, Irbaz helped me with finalizing the book as well, and your feedback has been helpful. So I want to thank both of you for helping me on my mission today, because Irbaz and Lawrence volunteered their time today to come here and share their journey, because they know that that's going to inspire you. And it means a lot. Thank you so much. And we'll stay in touch. And Irbaz is actually working in Guernsey today, so he's actually able to flourish. And I'm really pleased to see when trainees got on the other side. Great. So you've heard about Dr. Irbaz's story. There's many more I could tell you, but I want to show some of the key insight that might help you. This is Dr. Vijay, who actually failed his AKT multiple times. And he was at a point where he was given one last shot to actually show some evidence of progress before he was given extension to resit the AKT. So what he did, he decided he wanted to sit the SCA, but then he failed the SCA. And he thought after that, I'm never going to pass an exam. He was dejected. Then he thought about maybe I need some coaching, and he reached out to me. But after reaching out, he thought maybe I'm not able to afford this, and he didn't think he would be. So he thought about it. And then we had another chat, and then he said to me, I think I will do it because that's my last shot. And this was his second attempt at the SCA. And he had a lot of problem with self-doubt. He was doubting himself whether it was worth for him to pay so much money or whether to invest when he didn't know. But he followed his gut feeling. Sometimes it can feel scary to make that next step. But have you had a time when you made that step and then things work out for you? And that's what he did. He believed in himself, actually joined the program, and his score went from 65.5 to 86. That's a jump of 20.5. And given that he's not even past the AKT, he managed to score that well. That shows you that even if there is some problems with the knowledge base, you can still have the right system to get you to actually succeed. But it's just, first thing is a mindset. Then it comes to how do you prepare, the strategies you put in place, and the support you get. And we've also got other trainees as well. So this week I was interviewing Dr. Muhammad, who was on his 5th attempt again. And every time his score was just a couple of marks, few marks. And then he decided, I need to try something new. And he got coaching and he went to the city's exam, scored 85. And we've got other trainees who've actually shared their journey and they've scored high as well. So this is Dr. Gordon, who achieved 87 in his 4th attempt. And he couldn't believe it when he found out. And we're still in touch. He even actually invited me on his wedding day, and it's really good to see now he's relocated in Manchester and he's thriving. So we've got over 89 testimonials and people who actually voluntarily share their experience because they believe in the program. It has made a difference in their life. And this is Moed Malik, who joined our course, and actually he sat his exam first attempt, passed it. He found the feedback valuable, and it put him in the best position to pass the SCA. This is Arsalan, a GP trainee who was struggling with a lot of anxiety, and he passed his exam first attempt. And this is Dr. Sana Khan, who passed her exam, and she was struggling and she hit a brick wall. And then the reason she got help was because she exhausted every help she could get from her deanery. Despite the support from her supervisor, they couldn't find out what was wrong. And she joined the coaching, tried something new, and passed. This is Dr. Inamuna, who passed his exam on his fifth attempt as well. And there's many more I could tell you, but the main thing is this program is not for everyone. It's only for those who are committed, who want to try something new, open-minded, and willing to actually make the change. If you don't change something and you keep doing the same thing, you get the same results. But if you make that change, then you will see that you will get different results. So I want to leave you with 3 key insights today. If what you're doing isn't working, possibly it's time to change your approach, okay? And you need to think about what strategy you're using. Sometimes if you just keep working hard, you're busy with working hard, then you're not actually having time to strategize. And with that new strategy, you're probably locked and doing something that actually is wasting your time. Whereas there could be a door that is open, you're not seeing it. And you don't have to start from scratch. Okay. Very important, follow a proven approach, especially if it's your last attempt. And a big part of my training has been my supervisor. And this is Dr. Ryan Francis, who actually shaped my consultation. She shaped how I became a GP. And I think nowadays what I'm seeing among the trainees I'm working with is that because trainers are really busy, some of them are not getting that level of support, that one-to-one. And that's why some of these trainees are actually struggling a lot. And some of them have decided that they need to take their ownership of their own career and get the help they need. So even if it's not from myself, please make sure that you get help from somebody you can trust who fully understands the exam. Because there is a lot of free advice everywhere, but that could be more expensive to you. So you have to be thinking about your career, where you want to go to, and whether you're all in, or if you're not all in, then you might be wasting more time and energy. So if you haven't got your book, then make sure you get your book at drerwinkwun.com, and then there will be a link to go to purchase it on Amazon. And I hope that you found this useful today, because my goal is to help you, and my promise was to help you look at the consultation differently and show you the blueprint. And I hope that you find it useful. If you've got any questions, please feel free to ask your questions. No? Right. So if you don't have any questions, then, okay, somebody's got a question. Pass mark out of 100. So the pass mark, the pass mark is actually around 75, 76, and that's usually been the pass mark, but it's out of 126.
Thank you, Dr. Erwin. I really benefited from this section. I just wanted to confirm, how long does the one-on-one session take? Is it like a month or 2 months? What's the duration?
That's a very good question. So the one-on-one is personalized based on when you're sitting your exam. So for example, we've had trainees who join the one-to-one, and join it and it was 4 weeks, like Dr. Lawrence. We've even had trainees who joined it 6 months before the exam and it lasted 6 months. But then we space a one-to-one session to actually maximize the progress. So it's personalized based on when you're sitting your exam.
Okay, thank you.
Right, thank you. So any other questions?
When is the master class, please?
Great question. So the masterclass is coming up on the 27th of November. It's going to be at 7:30 p.m. So if you got the book and then send me a receipt at erwinkwun@gmail.com, then you will receive an invite to the masterclass.
Erwin, sorry, I just wanted to confirm. Does that apply to those who pre-ordered it? Because I've already pre-ordered the book.
Yes. So if you pre-ordered the book, you will automatically get an email with a link to the masterclass.
Okay, I'll search my email there. Thank you.
Right. Yeah.
And also, just to confirm, those of us that prefer ebook that I've got from Kindle, that also applies, right?
Absolutely. Yes.
Fine,
So,
thank you.
but you need to make sure you send the email to me, and then I'll actually email you the link.
Yeah, I already did. Thank you.
Okay, great. Any other questions? I know some of you already got the pre-ordered the paperback, and it's on your way, and you will get it in the next 3 or 4 days. Right. Thank you very much for actually being here today and staying up until the end. And a big thank you to all the GP trainees who've gone through the program and shared their story today, because without you, I won't be able to do what I'm doing. Thank you, Irbaz. Thank you, Lawrence. And thank you, everyone who's been there today. And I hope that you have a good weekend. And I'll see you at the SCA Masterclass. Take care, everybody. Bye-bye.
Thank you, Erwin. Bye.
Thanks, Erwin. Thank you.